Welcome to Clinicals with Pharm Vic. Today we will be learning Aciclovir. This medication belongs to the class of medicine called Guanine analogues. Following phosphorylation by viral and cellular enzymes, Aciclovir inhibit viral DNA polymerase and DNA synthesis. Indications: treatment and prevention of herpes simplex infections, shingles, acute chickenpox in immunocompromised patients, herpetic eye infections. Precautions: allergy to aciclovir or valaciclovir, contraindicated. Neurological abnormalities: increased risk of reversible encephalopathic changes, for example seizures, hallucinations with intravenous aciclovir. Renal impairment increases risk of nephrotoxicity and neurological adverse effects. Dose adjustment required. Consider whether fluid restrictions allow adequate hydration. In dehydration, aciclovir crystals may precipitate in renal tubules and impair renal function. Elderly, at increased risk of neurological adverse effects. Pregnancy, safe to use. Breastfeeding, safe to use. Serious adverse reactions to individual drug or metabolite, contraindicated. Common adverse effects include nausea, vomiting, diarrhea, hallucinations, headache, encephalopathy, injection site reactions. Infrequent adverse effects: agitation, vertigo, confusion, dizziness, edema, renal impairment, arthralgia, sore throat, abdominal pain, constipation, rash, weakness. Rare adverse effects: coma, seizures, neutropenia, leukopenia, crystalluria, anorexia, fatigue, hepatitis, Stevens-Johnson syndrome, toxic epidermal necrolysis, anaphylaxis. Dosage: adult genital herpes simplex, initial infection, oral 400 mg 3 times daily for 5 to 10 days. Recurrent infection, oral 400 mg 3 times daily for 5 days or 800 mg 3 times daily for 2 days. Initial or recurrent infection, HIV positive, oral 400 mg 3 times daily for 5 to 14 days. Severe infection, IV 5 to 10 mg per kilogram every 8 hours. Prevention: oral 400 mg twice daily. Prevention: HIV positive, oral 400 mg twice daily. Other herpes simplex infections: orolabial treatment, oral 400 mg 5 times daily for 5 days in selected cases. For example, severe infection, immunocompromised patient. A dose of 400 mg 3 times daily for 5 to 10 days can be used in HIV infection. Encephalitis, IV 10 mg per kilogram every 8 hours. Acute mucocutaneous infection if immunocompromised, IV 5 to 10 mg per kilogram every 8 hours. Shingles, chickenpox. Shingles, oral 800 mg 5 times daily for 7 days. Disseminated shingles, IV 5 to 10 mg per kilogram every 8 hours. Chickenpox or shingles if immunocompromised, IV 10 mg per kilogram every 8 hours. A dose of 15 mg per kilogram has been used in HIV infection. Child 3 months to 12 years, herpes simplex encephalitis, intravenous 500 mg per square meter every 8 hours. Lower doses of 250 mg per square meter have been used. Less serious herpes simplex infections, 250 mg per square meter every 8 hours. Oral 10 mg per kilogram 5 times daily for 5 to 7 days or until there are no new lesions. Use 20 mg per kilogram 5 times daily for 7 to 14 days in the immunocompromised. Chickenpox, shingles, IV 250 mg per square meter every 8 hours. Higher doses of 500 mg per square meter have been used. Oral 20 mg per kilogram 4 or 5 times daily. Use 20 mg per kilogram 5 times daily in the immunocompromised. Renal impairment, primary and recurrent genital herpes simplex. Adult CRCL 10 to 25 milliliters per minute, oral 200 mg every 6 to 8 hours. Adult CRCL less than 10 milliliters per minute, oral 200 mg every 12 hours. Shingles, adult CRCL 10 to 25 milliliters per minute, oral 800 mg every 8 hours. Adult CRCL less than 10 milliliters per minute, oral 800 mg every 12 hours. IV route, adult CRCL 26 to 50 milliliters per minute, IV 5 to 10 mg per kilogram every 12 hours. Adult, CRCL 10 to 25 milliliters per minute, IV 5 to 10 milligrams per kilogram every 24 hours. Adult, CRCL less than 10 milliliters per minute, IV 2.5 to 5 milligrams per kilogram every 24 hours and after hemodialysis. Counseling, make sure that you drink plenty of fluids. Recurrent herpes simplex infections. Carry a course of tablets with you so that you can start them as soon as you notice symptoms. Dosage 5 times daily. Take every 4 hours during waking hours. This medication may make you feel dizzy or confused. Don't drive or operate machinery if you are affected. Practice points: ensure adequate hydration to minimize renal adverse effects. Changes in renal function during treatment usually respond to rehydration, dosage reduction, or stopping the drug. Avoid extravasation as injection is alkaline. Chickenpox in a pregnant woman may be associated with severe morbidity and mortality. Consider treatment. Consult an infectious diseases physician for management. Shingles. Start treatment as soon as possible and within 72 hours of rash onset. Consider treatment after 72 hours if high risk of severe shingles or complications like immunosuppression, progressive clinical state. Aciclovir seems less effective than Aciclovir and valaciclovir in reducing the duration of acute pain. Cross-resistance may occur between agents due to their similar mechanisms of action and activation pathways. This is the end of today's lesson. Share this video, like and subscribe to my YouTube channel at Clinicals with Pharm Vic. Also follow me on Instagram and Facebook at Clinicals with Pharm Vic. Let us grow together, learn, study and revise.